was plugged it up and get it out. There's only three of us, isn't it?
So before we start, Helen just come in.
We should find a slot where you put gentle growth barriers and adaptations, if that's okay.
Dominic? Excellent. Thank you, and hello to everyone joining us this evening. The Adults and Health Scrutiny Panel Budget Scrutiny meeting. I'm just going to go through a few notices as part of the normal process about filming at meetings. So it's on number 1 on the agenda pack, but for those who don't have it, please note that this meeting is being filmed or recorded by the Council for live or subsequent broadcast via the Council's internet site or anyone attending the meeting using any communication method. Although we ask members of the public recording, filming or reporting on the meeting, excuse me, not to include the public seating areas, members or public attending, they should be aware that we cannot guarantee they will not be filmed or recorded. So by entering the meeting room and using the public areas, which no one else has entered other than us, you're consented to be filmed and to the possible use of these images. Number 2, apologies for absence. Dominic?
Yes, apologies for absence received from Councillor Demir. Also, Councillor Blake has given notice that he will be late to the meeting, but we are expecting him later.
Excellent, thank you. Items of urgent business?
No, none received, Chair.
Thank you. Declarations of interest. I always say my sister's a GP in Tottenham and I'm a member of the RCN. Anyone else got any declarations of interest?
I work for NHS England, but it doesn't have any bearing on what we're discussing tonight. Thank you.
Deputations?
No deputations tonight.
The minutes, pages 1 to 10. Does anyone have anything they want to raise about the accuracy of the minutes?
That's Tuesday meeting. I was in another scrutiny meeting Tuesday. This is fine.
That was fine. Anything for you, Councillor Peacock?
No, except to compliment Dominic because the
You
minutes
put your thing on.
I'd like to compliment Dominic because the minutes are absolutely thorough. They're spot on. Well done.
Thank you.
We always like those things recorded. Thank you. Thank you, Councillor Peacock. Okay, so we're now going to move straight on to the only agenda item for tonight, which is the scrutiny of the 2022-23 draft budget, 5-year medium-term financial strategy, and that's from pages 11 to pages 74. So if everyone can turn to that. Now, I've just realised that people have got different numbers. If it's the number on the very top of the pack that you're reading that we're following tonight, so that everyone everyone realises. So about introductions, I'm going to briefly introduce myself and my colleagues around the table. Can I ask colleagues on the call if they could introduce themselves as they come on to speak? And that would be helpful. And then I'll ask who's going to be leading us in the first part on the revenue budget. So I'm Councillor Pippa Connor. I chair the Adults and Health Scrutiny Committee. And to my right, Councillor Bull.
Hi, I'm Councillor Gideon Ball, Councillor for White Hart Lane Ward.
Councillor Peacock.
I'm Councillor Sheila Peacock, Councillor for Northumberland Park.
Great, thank you. So for tonight, what I suggest we do is that we go through, so we start obviously on page 11, but we look at the main part of the Council's budget, as in the overall part. That really gives us a really helpful understanding. If we can understand those figures at the outset, it helps us put the adults and health budget in that, so we've all understood it. And then also to the co-opted members. Actually, that's a good point. Our co-opted members didn't come on and introduce themselves. So Helena, sorry, apologies. Do you want to come and introduce yourself?
Yes, my name's Helena Kanya and I'm one of the co-optees.
Excellent. Ali, are you able to come and introduce yourself?
Yes, I am Ali Amasyali. I'm a co-optee as well.
Excellent. Excellent. So we're going to start with going over the main part of the budget, the big figures, so to speak, and then we'll sort of scrutinise further down into the adults and health revenue. Then we'll go on to the capital side of things, and then last but not least, and the main part of the meeting, we're actually going to look at the budget growth areas. We're going to look at the draft capital programme and the savings tracker, and those are found at the appendices at the back of the pack. So I'm going to hand over now to officers if anyone would like to start giving us a very brief overview. I've got 4 people looking at me. I don't know who's going to be.
So Josephine is going to give a brief.
Excellent, Josephine.
Hi,
You
good
disappeared. Hi, Josephine.
Sorry.
You can introduce
Hello,
yourself.
Councillor. Hi, I'm Josephine Lysett, and I'm the Head of Finance for People Services in Haringey. So I understand in terms of the kind of financial briefing around the papers, we've provided that already. So I'm just going to do a quick high level of the paper, and then if you have any further questions, just let me know. Is that okay?
Thank you, that's excellent. Yes, the more time we have for questions, the better. So we have a lot, so that would be great. But thanks, Josephine, over to you.
Okay, so as you can see from the paper, so I'm referring to Appendix B. So the 22 for the whole council, it's a kind of 5-year MTFS plan. So it covers 22-23 all the way to 26-27.
Sorry, Josephine, can I stop you? When you say Appendix B, we've got Appendix E in our packs. Where's the B? What page are you on?
I haven't got it in terms of pages. Dominic, could you help me out here?
Sorry, we'll just stop for a second so everyone's on the right, looking at the right part. Thanks.
Yeah, I think this is starting from page 19. Appendix B is the main cabinet report, right, from earlier this month. Is that right?
Okay, so the main cabinet report, yes, page 19. Well, we've got page 19.
Okay.
Yep, over to you.
Yep. Okay. So the heading on it is 22-23 budget and the 22 to 27 medium-term financial strategy. Yeah. Okay. In terms of the MTFS, there's a budget growth request and proposal across the whole organisation of 11.85 million, of which the adults and health proposed growth allocation is 2.41 million. Enabled for us to balance the budget in 22-23, there has been a short-term use of balances of about 5.8 million to make this possible. In terms of the budget for 22-23, it assumes that there's a council tax. The maximum is 2% required by government, and then the adult social care precept increase of 1%. In terms of the previously agreed savings, there aren't any savings being put forward by adults and health. However, over the 22-23 to 25-26 NTFS period, the adults allocation in terms of savings target is 4.7 million. In terms of the revenue budget for the total of adults for 22-23, the allocation or proposed budget is 82 million.
Sorry, Josephine, can I just ask Councillor Bull's got a specific question on one of the figures you've just mentioned.
So, Josephine, can you help me? So,
okay.
The other day at work, where I work in NHS England, we have a regular catch-up with the interim head of strategic finance, and he indicated that additional money was being given to local authorities. The announcement was made over the weekend. Additional money was given to local authorities for adult social care, principally to help people that are in hospital get out of hospital back into the local authority setting, so those beds can be freed up for COVID patients. Is that going to be factored in? Obviously, it couldn't be factored into your paper because that announcement's only just been made by the government over the weekend. But where will you be able to cover that in your presentation? Because it's new money, from what I can understand.
Yeah, so it'll be new money to fund additional expenditure. So it hasn't been factored into here. You're absolutely right. But any kind of funding that does come, we will match it against any additional expenditure that will continue to occur.
Josephine, can I just be clear? Have we got any understanding at all, whether this will be in the millions, or, are we looking at a substantive amount of money that's coming in through this allocation, or honestly, have you got no indication at all yet?
I have no indication at all.
Okay, thank you. Yeah, sorry, please continue, thanks.
Right, and in terms of the capital budget, it will remain as is. There hasn't been a request for any additional resources or growth within the capital programme. So in terms of the 22-23 to 26-27 budget allocation for capital, the figure is 73 million.
Sorry, Josephine, can you just point out to the last figure that you've mentioned and say where within the papers you've got that figure from?
Right, so if you go to, apologies, I'm just scrolling down.
1.15.
Sorry, bear with me. So table 8.2.
That's on page 47 of the pack.
And under people adults, total allocation 72.8 million.
I'm just going to clarify. So we're just talking about the capital, aren't we? So we've moved on from the revenue part.
Yeah, that's the capital allocation.
So that's in a different part of the pack. That's this
57?
47, I think. Okay, thanks, Josephine. Okay, we're going to start questions and we're going to go right back to obviously the beginning. So on page 19, thank you for that quick whiz through for us. That was really helpful. So we're going to just unpick some of the figures right at the beginning, just so that everyone's really clear on the call tonight what the figures are and what they specifically mean. So I'm just going to be really clear to start with. On page 19 at 1.4, you say at 2022-23 budget, and you say that there's already an agreed saving strategy of £12 million. So that's the savings that need to be made in the next financial year, is that correct?
That is correct.
And as part of that, adults and health, am I correct? I think it was it 4.1 million?
It was 4.7.
4.7 million. Hang on, you can ask. So there's a request here for. So how does that have the 4.7 million for the new allocation? So how was that figure arrived at? Is the question.
So it's an existing savings target. So the MTFS savings program from last year, their existing targets, and yeah, that's the figure. So it should be in the budget in the paper as well. So let me just have a look where that is situated. Bear with me. Sorry. So table 7.2, agreed savings 2022 to 2026.
Page 40 on the pack.
And as you can see there, the total savings is 4.7 million across the next MTFS period.
I'm going to ask Councillor Peacock and then Councillor Bull.
It must be me that's, I don't look at it as savings, I look at it as cuts. And I want to know why and what's going to suffer as a consequence of this.
So does one want to discuss the next savings proposals? Are you saying that sorry, Josephine, are you saying that 4.6 million savings proposal is in part encompassing the current MTFS savings on the tracker that we've got at the back of our document, back of our pack on page 71 and 72, which we've got as totaled as, I think, 3.1 million for this year, and then next year 1.6. How does that fit in? How do those two figures? I can't hear you, Josephine. Sorry, I think you're on mute, or maybe if someone else would like to come in. I think Josephine's having some problems with her mic.
So, good evening, Beverly Tarko, Director for Adults and Health. I don't know the paper that you're referring to. It's unless you can give me a page number, Councillor.
Yeah, so sorry, I thought I did. It's page 71, page 72 is the savings tracker for the next year. And at the bottom of that, we've got a savings that are supposed to be being agreed. Now, I know we've got some overspend on that, and I think the question is the 4.7 on page 40 of the savings that now need to be made in the next year, 2022, is that encompassing the current savings that are in the tracker and new ones, or is this a new set of proposals, was the question. Thanks.
Okay, thanks. So the table on page 40 is the previous NTFS trajectory for savings. There are no savings for this current MTFS. Let's just be clear about that for 22-23. The previous MTFS, whenever we do an MTFS, it spans a 5-year period. So it's already baked into the budget. So my understanding is that 4-odd million is already baked into the budget. It's not new savings that we are being asked to make this year. And when that was baked into the budget, there was some assumptions that were made about how we would deliver those savings for next year. And the pages on the tables on page 70 to 71 relates to the targets for this year and how well we are doing that have already been baked into the budget, and how well we are doing in delivering those outcomes. Does that sort of make sense?
So I've got at the bottom of page 74, Beverly, on the year 2022-23, the total savings for people adults is 3.9 million. And I think the question is that 3.9 million the same as the table on page 40 of 4.9 million? And if so, there seems to be £1 million difference. Or I could well be reading that table incorrectly. So it's just really just to get that clear at the outset before we move on. Thank you.
Right, so the agreed savings over 2021-22 to 25-26. The first year of that, 21-22, which is the existing year, is 22-23 beyond, which is what the discussion is today, is the additional 4.5. So a total savings of 7.68 million across the MTFS, including this year. So you're right, Councillor Connor, we've got 3.2 for this year. And then over the course of the MTFS, which we're discussing now, 22-23 beyond, we've got an additional 4.5.
I'm sorry, I'm absolutely no good at figures or anything like that, but I am good at knowing what is a cut. And to me, saving is not a saving, it's a cut. It's a cut. And that's the way you're saying, I'm always saving this money because we're not spending it on that. Well, I would like to know what you're actually depriving of the money. Perhaps Beverly can answer. Because I'm an old person and I deal with a lot of old people. And I know how desperate they are for help. And then if I said to them, oh, you can't have that anymore because that service has been cut.
No, I understand. I understand the question. So just to be clear, our budget sort of management strategy is very clear and it has 3 strands. We look at managing the market, i.e. how much we pay for care to providers. And we do that by trying to stabilize prices and to make sure we pay the right price for care. So there have been instances where we've, in previous years, when our cost of care as compared to comparator neighbours has been higher than one should expect. So we've been doing some concerted work together with our sort of NCL boroughs to actually manage the cost of care. So we actually arrange together across the 5 boroughs to make sure that we are paying the right cost for care. So that's one strategy. And in doing that, Councillor Peacock, it means that we've been able to reduce the unit costs that we pay providers over a period of time. That's one strategy. Another strategy, the second theme of the strategy, is actually around demand management. So we know that if we don't intervene early and cases get to a critical point, it comes to a point when it's quite expensive in terms of the complexity of need that presents. So we have what we call some early intervention strategies to delay and reduce the need for care. And that means working in quite a different way with our residents and population and trying to, for example, reablement has been an effective way of increasing people's abilities and functions to mean that they don't then need long-term care packages. They can actually increase and improve their functioning over that reablement period. And that's quite an intensive approach. That's just one example. The third way the third theme to our budget management strategy is really looking at our operations management. So how our practitioners actually work. And over the past 2 years or so, we've developed collaboratively something we call a strength-based approach, so that we make sure we're having the right conversations with our residents when the social worker, the practitioner, or the occupational therapy has that right conversation. And it looks at, for example, what is the individual able, how is the individual able to support themselves? What supportive systems around them in their locality might help? Is there a role for assistive technology to play in terms of the supporting the outcomes for individuals? So that sort of collection of approaches we call as strength-based approaches. And there's evidence to suggest that if we get that right, actually we not only improve outcomes for residents, but it also reduces the cost of paid care. So those are the 3 strands of our strategy. I think Councillor Peacock, and I'm going back a few years, in previous years, yes, we have cut services. We have closed day services. And I think we all remember those times well. That is not part of our budget strategy at present and has not been for the past 2 years. So in what I believe is your understanding of cuts to services, there are no cuts to services in terms of our approach to our budget management. I hope that is clear.
So can I just check with Josephine, sorry, just on the figures. Thanks, Beverly. That was very helpful. But can I just check on the figures with you, Josephine? Because I think I'm a little bit confused. So on page 40, we've got the savings in adults at 4.161 for this year, and then the following year at 535. But on the savings, the agreed savings priority on page 74, we've got a total of 7.6 million. So it's 3.161 this year, and then the following year 3.980. Can I just check with you which figure is it? So is it the fact we're going to be making 7.6 million pounds worth of savings over up till 2026, or is it 4.69 on page 40?
Yeah, so just to break it down, so you're right, up to 2026, the expectation is to deliver 7.6 million. In terms of discrete years, so that means in 21-22, this financial year, the target is 3.2 million. The next financial year, 22-23, which is when the period of the MTFS starts, or what we're discussing tonight, it's 3.98 million. Then the following year, 23-24, the target is 535k. And then in 24-25 and 25-26, nothing. So it's allocating that 7.6 million across those discrete 5 years, which includes 21-22 up to 25-26.
Thank you, Josephine. And so just to be really clear, so all these savings are coming from the current table that we have in front of us, and there's nothing else added to that. So everything on this table, but the totality is 7.6 million, rough estimate. Okay, thanks.
Including this financial year.
Including this financial year. Thank you, Councillor Bull.
So it's 2 questions. First one's to you, Beverly. So there was an article in the news the other day. There was a lady being interviewed who runs a caring service. I think she was caring, her and her husband run a service where they were caring for a number of residents in a particular area. It doesn't really matter what area it was, and they were being commissioned by the local authority. And this lady was being asked to take on more residents. And she said, I can't. She said, because I just can't get the staff because of the concerns around how much carers are being paid. And this is another issue that this government has created by, some organisations, they don't pay the carer for the time when they're travelling from one place to another. So actually they become not earning the London living wage or the minimum wage. So can you just give us a flavour of the kind of experiences your team are having in those situations of trying to commission additional caring support because of the government wanting to get people out of hospital? I don't mean premature discharge, but making sure that the infrastructure is in place so that we can free up the beds for COVID patients. So what challenges are you facing? That's the first question. The second one, and this is an old chestnut and I'm going to rehash it again, just give us a little bit of a flavour about impact analysis when you propose a particular saving to be made. So let me give you an example. If in the Environment Department they decide that they're going to sweep a street once a week as opposed to sweeping it 3 times a week, the impact analysis would be, okay, what is the effect going to have on that street? Is it going to be grottier, more litter, What's the impact analysis that do you do the similar sort of impact analysis on some of the savings you make? And within that, are there discussions, and I've raised this before, I've always said for every £1 you take out of adult social care, you probably shunt on 3 quid to the National Health Service. What conversations are you having with your health partners And I suspect that will be made a lot easier when the integrated care system legislation gets through the House of Commons, because that will make those kind of conversations a lot more fluid. Hopefully that helps. Thanks.
Yeah, if I can start with the sort of workforce challenges first. And obviously this is a national issue. We know we pay the London living wage for our home care providers. That was something we brought in, well over a year ago. So we know that our sort of home care providers are paid the London living wage. And that obviously helps, because we know that people are getting a good wage for the very valuable work that they do. However, we know that care providers, these are our commissioned services in care homes, residential homes, etc., that people very often, staff very often, are not paid an adequate wage. That is why we, the collection of ADAS members and allies, have really been petitioning national government for the appropriate social care reform funding that will enable us to improve the working conditions of our commissioned staff in residential homes and care homes. We have not received that funding settlement. And it was referenced at the beginning of the session, what the government is doing is giving us one-off, what I call grant funding, to support us through crisis situation, such as we face ourselves when we come onto winter, and such as we face when we have COVID variants on the horizon. That is very time limited. You usually have to spend it within a few months. And what certainly I can talk about sort of the workforce grant for phase one, the phase two is still very early days to understand what's going on there. But what we were able to do was to transport to our care home providers funding to enable them to support workers who are working for very poor wages. It covered things like absence during COVID, some of those issues you talked around that would be very supportive to support staff to actually fulfill the job that they're doing. But it's short-term funding, and we continue to petition central government for the proper funding for our care profession. So it's not just about wages, it's about training, career progression. We know there are issues around inequalities. The majority of carers are women. There's a significant number that are from Black, Asian, and minority ethnic groups. So it is very much a complex picture, but one that is so important that we continue to fight that corner. The short pots of money will just not suffice in terms of that right outcomes that we're looking for. So that remains a challenge. In addition, we know that we have some specific workforce challenges, particularly with therapist staff. So you talked about health and care. And previously I mentioned reablement as a really important intervention. Community rehabilitation, which you'll be familiar with, Councillor Ball, is also a really important intervention for people when they're discharged from hospital. We are actually experiencing the whole country that sort of workforce shortages around those therapists' input. So the situation is quite serious if you look at it nationally. If we, closer to home, we monitor practically daily what the situation is with regards our staffing, people who are vaccinated, and the ability to actually conduct the work. We know in some parts of the country, in the north, for example, care providers are handing back work and that they're actually not taking on commissions because they don't have the staff. We are not in that position. Let me just make that clear. In Haringey, in fact, in London, we are not in that position. We are holding our own. But obviously we need to keep a close eye on it, because with the situation at present with Omicron, we know that there could well be adverse impact of people staff having to isolate and not being able to turn up for work. So it is quite a fragile situation. So work for us is one of our top priorities, and building that capacity, challenging and making sure that we do everything we can to make sure people get the right pay for the long term and not just for the short term. In terms of your question about impact analysis, the savings we make, what's the knock-on impact? So I think you will have understood the strategy we are now taking, not the strategy we took in previous years. One could say that when we previously closed day centres, there was an adverse impact to some sections of the population. We have developed a more appropriate strategy, which I've just described. I won't go through it again. But what fundamentally at the basis of that approach, I talked about things about strength-based approaches. I talked about things like improving outcomes for people receiving care. It is very much a positive approach to actually reducing the cost of care, as opposed to having adverse impacts. And that's not to say that that may not happen unintentionally. So it's important for us to constantly review and monitor and to make sure that we're keeping on the right track. And having that feedback loop from the people we actually support is really important. Stories of how a strength-based approach can actually improve an individual's life and give them a level of choice, control, and autonomy. I can provide the panel with some of those. And then you talked about our health partners and how far we are working together. So obviously, I would say through COVID, we've demonstrated that admirably. You know, I would say, you know, everybody talks about the NHS and the sterling work that's been done, but actually we couldn't be where we are in terms of our successful outcomes if social care actually wasn't hand in hand in partnership, supporting hospital discharge, supporting people to go to the right place when they're discharged from hospital. And that may not necessarily be a care home. The majority of people say to us, we want to go back to our own home. And that's what we try to facilitate by having the right conversations. We know that there's pressure in the system. We know that we're in for a really challenging time. But I think the way we work with our partners is really complementary. I think it's very collaborative. We have integrated discharge systems across NCL, which supports placements across the sub-region. And I think certainly we've developed through our COVID response to a more robust way of working with our partners. And I mustn't forget the voluntary sector. You talked about health partners, but the voluntary sector also supports people to come out of hospital in a timely fashion. They also support people from going into hospital, you know, the whole sort of admissions avoiders. So I think we just really have to widen that sort of the partnership aspect of the work we do. So obviously health partners are a significant part, but we mustn't forget the voluntary sector.
Thank you, Beverly. Just to sort of say, obviously that's great to hear that overview. As it's budget scrutiny, we're going to carry on the finance bit for a bit, just to get some unpicking of the figures. We'll have time at the end, I'm sure, to sort of do a wider chat, you know, sort of the background to it in a greater depth. I've got Councillor Snev's hand up, which I think is coming back on Beverly's point, and then I've got Councillor Blake.
Thank you. And given the comments you've made, I'll stick to the onion, so to speak. I think with all the talk about money and a kind of blurring sometimes in the press and nationally around adult social care and health, there's a danger that we don't really understand that there isn't really this kind of huge flood of money coming into adult social care, or that this huge flood of the kind of change. And I think Beverly's touched on that we need in order to have that kind of medium term and long term security and vision for adult social care. So I think it's just really important. And I know Gideon, you know this, but just really important that everyone and the public understand that there isn't a vision which really places social care on that equal footing to healthcare. Having said that, locally, I guess to reassure, when it comes to the integrated care system, we've been doing some really intense and very close work with partners, Beverly's talked about the work we're already doing together, but also the planning and preparation in order to strengthen those relationships and also really strengthen the voice of local people and local residents in that process, in how they inform the services, the changes we make, etc. And the last thing I'd say is that early intervention and prevention they're a political thing. They are about, yes, they are about us saving money by not spending later, but they're also about people's quality of life, about our community and how we look at an individual as a part of the community, as part of our society, and how they interact with health, how they interact with us, how they interact with the voluntary sector, with friends and family. All of those things really important in that early intervention, in preventing them being more ill, in preventing them, yes, needing more costly or more complex services, but mostly in enabling them to live their best life, whatever situation they're in personally, whatever health condition they experience, whatever age, etc. So just wanted to make those points really, because I think they're really important when we're setting the budget, when we're talking about what the strategy is. That's what we're really talking about.
Excellent, thank you. We've got Councillor Mark Blake. Do you want to quick introduce yourself? Thanks.
Thanks, Chair. Councillor Blake, Woodside Ward. Yeah, I just had a couple of questions really, sort of kind of following on from Councillor Ball's question, sort of reading through the papers. What I couldn't grasp really was kind of the key risks with this budget. I think some of them have emerged through the conversation, but it'd be nice to have a kind of succinct summary around that in terms of this sort of 5-year projection. And obviously, I spent a bit of time recently in the cabinet. In community safety, you kind of knew you had a 3-year block grant from MOPAC every 3 years. The mayor does his police plan. We put a bid in. That covers 90% of our community safety funded sort of programs and services. My sort of reading through all this information is that that's not the sort of same situation here in terms of adult social care. So I just like a kind of real succinct kind of, 1, 2, 3, 4. What are the kind of key risks with this budget moving forward? And the other thing, which is a broader point, which hopefully the chair won't mind me making, is that we visited on a panel visit to a sheltered housing scheme in Muswell Hill a few Fridays ago. Not a week, it was a week Friday. And what I found very interesting with that scheme was, for me, I had a concept in my mind around sheltered housing, around it being sort of semi-independent. And I left with a feeling that there are quite a number of medium to high risk people, far more than I thought, kind of living in that accommodation. And that in itself to me is a risk. Because what I saw, and you can correct me if I'm wrong, is the risk of groups of not just elderly but other vulnerable groups in that accommodation actually falling into the kind of acute category because they're not getting the kind of support that they need. Maybe that's a wrong assumption. I'm kind of new to adult social care, but again, I'll be interested to hear the director's views on that. Thanks.
Okay, so thanks. I think those questions are directed to you, Beverly.
Yeah, no, so the key risks, and thanks, Councillor Blake, for your question. I'll come on to the shelter scheme afterwards because I probably need more information. But I would say the key risks are what I've mentioned before about government funding for social care and the appropriate funding to support reform. That's a key risk going forward. We know that any settlement we've had to date is not adequate. We are entering into ICS integrated system by April, more formally by April. I think there are still some unknowns and uncertainties with how that would work, that I think there's a potential for some risk there. We've got increased complexity and demand because of the impact of COVID. And we're already seeing that play out in terms of the numbers and complexities of care, home placement breakdowns. I think that remains a risk going forward. I think workforce, as I've said before, remains a top priority for us, not least the sort of not just numbers, but that capacity and resource to support the range of work that we address in social care. And then there are some changes coming forward, such as the sort of inspection regime, which one could look at not just as a risk, but actually as a positive. But if we compare it to the system with children with Ofsted, for example, we know that when you have an inspection regime, much as we had many years back in adult social care, the service has to really prepare, and we've already started that preparation with a self-assessment that is ongoing, around how robust our quality assurance system is. I think what comes out of that is yet to be seen, but it's something we've got to bear in mind. There are also some legislative changes that are coming ahead, such as liberty protection safeguards, which is another sort of very intensive, resource-intensive way of working to support people to have their sort of rights protected, and that is likely to come next year. So I would say there are some legislative challenges, there are some funding challenges, there's a complexity of care that we know COVID landscape has brought, which brings a certain level of uncertainty, and of course the workforce challenges in terms of those risks. In terms of the sheltered housing, I'd have to know more about that, but generally did you say it was sheltered housing or extra care in Muswell Hill?
It's sheltered housing. Sheltered
housing. Charlotte, do you know what that might be? Sorry.
Yeah, thank you. I'm Charlotte Pommy, Assistant Director for Commissioning, and thank you, Councillor Blake, for your question. I think.
Can I just add a point of clarification, just on that, Charlotte? Just before, I mean, the general point is that sheltered housing, for me as a novice to this area, I had a view it was going to be semi-independent, that it's kind of supporting people to be semi-independent. The picture I left with was that we've got quite a high number of, I'm not going to say acute, but certainly medium support needs people. And the kind of feedback we had from the residents who we did manage to meet was that maybe some of those individuals aren't getting the level of support that they need. That was the concern for me, kind of coming out of that meeting. Thank you.
Yeah, thanks for that. And we'll certainly pick up the individual points about individuals who aren't feeling that their neighbours aren't getting the support they need. You're right, on the sort of spectrum of needs, it's probably at the more preventative end, so it is about early intervention as needs become more acute. It offers some oversight, offers some opportunities for that sort of shared care, for communal activities. It's not generally seen as at the more acute end, but at the same time we do have a model where we say ideally wherever possible we want people to stay in a sort of home for life. So if people have moved to sheltered housing where possible, we would bring in care and support so that they wouldn't need to move again. But sometimes people do need to move into nursing care, for example, or into extra care sheltered. But and it should be that the care and support is available around individuals, and that is determined on an individual basis. But we'll certainly pick up any individual cases, and I'll get in touch with Helen. I think it was Cranley Dean you were at on Friday, was it?
Yeah, and I think we'll pick this up as part of the scrutiny we're doing into care and support and health and social care support within sheltered housing.
But obviously, if there are some more pressing issues about individual cases, which is what I'm hearing from Councillor Blake, we'll pick that up immediately. Thanks.
I think it was just an overall impression I think he came away with. I've got Helena's hand up. Helena, do you want to ask a question?
Sorry, frog in the throat. Yes, I think this is probably about the right place. It's really difficult to decide when to ask. It's about 7.10.3. I'm sorry, I haven't actually got the page number. I think it's page 38. And it's about service growth budget adjustments. And my concern is you've got a figure there of 8.6 million as a service adjustment for 22-23, and I have a concern that we've uncovered a lot more need, and as we go forward, I think that's not going to diminish. I think it's going to increase, and I'm just worried that there isn't enough there, and I don't know what you're putting by for the years that follow. So where does that put us, please? If I could ask that. I don't know who's going to answer, but hopefully somebody can.
Shall I start? And then I'll bring in Josephine.
Sorry, Beverly, it's quite difficult sometimes to hear you on the it's just the rebound sometimes coming in. So did you say you're answering that question?
I said I'll start and then you bring in Josephine. Can you hear me?
It's not great. Someone just put their hand up if they're going to answer the question and then go for it. Sorry, I can't quite.
Can I just confirm what table you're referring to or the page? I'm just trying to find it. Apologies.
Page 38, Josephine. So it's a question about the existing MTFS level of growth and whether that's sufficient. I think the answer is actually it's been looked at, it's been revised. It's now nearly 12 million. That's what I was going to say, if people can hear me.
Oh, I can hear you now. I can hear you now, Beverly, loud and clear. So it's gone up, is what you're saying.
Yes.
And what about following years? Will this be done on a year-by-year basis? Or
yes,
I see. So you just don't know.
So every year we have this round of reviewing and revising our MTFS, and the circumstances change from year to year in terms of government funding, in terms of the demand and how the budgets play out. But what Josephine did say at the beginning was for adults and health, there was an additional 2.4 million added to the previous assumptions around growth as compared to last year.
Okay, but you said 12 million.
No, for the whole of the budget.
Oh, for the whole of the budget.
Yeah,
and
that's for the whole council.
Okay, thanks. Yeah. I want
All right.
it all, Josephine.
I know, sorry. So 12 million for the whole council, of which adults and health has been proposed to allocate 2.4 million of that.
Can I just ask one more question about that? And it's really to understand whether you're suddenly going to find yourself in a position where that's not enough, and how will you deal with that?
So I can respond in terms of from a financial perspective. I think it's not an exact science, I'll be honest. We've got a model that kind of identified, the assumptions around demographics, the impact of COVID, and, based on what we know and at the point at which we were doing this process, we kind of reassessed and we've asked for an additional 2.4. If anything moves, as we know it has done in recent kind of weeks with Omicron, we just have to kind of identify as the evidence comes through what that impact is on the services and then play it back to our corporate colleagues what that might look like. I think there's also needs to be a conversation with our health partners on their role in that and what they need to fund. But again, with all things to do with health, it's also short-term funding, as Beverly said earlier on, and we can't de-risk the whole budget. It's impossible. And as you said, you want the whole 12 million. The council's made up other departments that are demand-led, such as temporary accommodation and children. So in a way, it's, we're fighting for a proportion of that 12 million. So it's about playing it back, revisiting the model, the assumptions as we know more, and then playing it back to our corporate colleagues, the pressure that we feel that will be a long-term pressure, and therefore it's a long-term growth we put into the budget.
Okay, thank you for that answer. Thank you.
I can't hear anything. I'm not sure about anybody else.
No, I can't either.
Councillor Connor is on mute.
So we're going to see if we can get some sound back. So we're just going to pause for a moment while we wait to see if we can get officers back.
We can hear you now, but we couldn't before.
Josephine, can you hear me?
Yes, yes.
Excellent. So can I just pick up on that last point actually from Helena? In the growth table, so can I ask where this growth money has come from that has been mentioned, around £8 million? So which reserve budget has this come from? I think it's the strategic reserves. Can you just tell us a little bit more about what that is and whether there's more money in the pot?
So I believe, and apologies, before I joined Haringey, I believe in terms of 2021, the expectation or the outturn was more favourable than we thought it would be. So as a council, we were able, and I think we were able to put into the reserves or stow away about 10 million worth of reserves, and therefore, that's some of that has been used to help fund the growth requirements for 22-23.
So a question that I'm going to ask, that the growth that's been mentioned now on table 7.1, there's 2.4 million for the next financial year, but after that there's the brackets round, which I'm assuming is a negative, and then it's 0 for 24-25. However, on the summary revenue budget position on page 41, we go from 83 million and a bit for the base budget to 82 on 2022. So it looks like our budget is dropping, even though we've got growth money apparently, according to table 7.1, coming in. So how does that work?
So it's quite complicated in terms of we're not seeing how the budget is built. So in terms of the adults budget, it's made up of obviously the kind of existing budget plus the growth. It also encompasses any of the existing savings program. So as you know, the savings for next year is or next year across the MTFS is about 4.5, 4.6 million. So there are different elements that kind of creates the budget, and it might seem there hasn't been an increase, but obviously there's an existing savings program that also has to be delivered as well. So unfortunately, the way in which it's been shown, you can't see the ins and outs on how we get to the actual final budget, and it's probably something we need to consider going forward, showing the panel.
Okay, so but I suppose from just if I was a member of the public and I just looked at that table, it does look to me like the budget is going down. Now, I agree with you, we can't see the ins and outs of all how the budget was put together, but are you saying that you are confident that actually the money going into the budget in 2022-23 is actually increasing from this year's position?
It's increasing in terms of meeting the associated or expected needs based on our model in terms of the increase in care purchasing. Obviously, that's factoring in just the kind of care purchasing elements. There will always be pressure and risk across all budget lines in a budget. So as we know more, we'll kind of feed it back to the kind of our corporate colleagues. But based on what we know now, the view is 2.4 million should be able to address the needs.
Okay, so I'm just wondering, as maybe a recommendation from the panel, is that we just ask for further information going forward about the base budget for 2022-2023. Because our understanding is that growth money was being put into that in order to increase because of the needs. Yeah. However, on the table, it doesn't look like that. So I think we just need some more information to give us confidence that is happening, that the base budget is increasing, although it doesn't look like it on the table. But I'll leave that point here because I understand that you'll need to go away and come up with a little bit more information for us. So thank you for that. I just wanted to ask as well about the position going from Q1 to Q2. My understanding was that there was an increase in we went from a £5 million approximately deficit to 10 million in sort of between Q1 and Q2. Is that across the whole council? Was that in adults and health, or what? Sorry, what portion of that was adults and health related? Sorry, Josephine, have I lost you again?
Sorry, bear with me. Sean, are you able to answer it? I'm just trying to look for the details.
Yeah, hi, Councillor.
Sean, sorry, I can't hear you.
Hi, can you hear me now?
Yes.
So can you repeat the question? You said the movement between Q1 and Q2.
Yeah, so in a recent briefing, we were told that the financial position had worsened. It went from £5 million to £10 million between Q1 and Q2. Now, my assumption is that's across the entire council, and I'm just wondering how much of that was adults and health related.
It was about 3.7 million.
So it went from what to what in Q1 to Q2?
So in Q1, it was, just bear with me, I've got this. So in Q1, it was 2.9 million, and in Q2, it was 6.6 million.
Okay, so that's quite a substantive increase. So I think you can guess the next question. It'll be if that happened between Q1 and Q2, what is there any sort of prediction of what might happen by Q4 in this area?
Yes, so I think when we were reporting for Q1, we were still unsure what the legacy impacts of COVID would be, and due to uncertainty, what we don't want to do is kind of overstate what our overspend would have been. I think by Q2 we had a much clearer picture of the legacy impacts, of the kind of sustained increase in demand and activity and in complexity as well, and that was to stay within the system. So we felt a lot more confident that the overspend was going to be quite substantial, and that's why we increased our projection for Q2.
Okay, so I'm just asking, so for Q4, is there a prediction on, now you've got a better understanding at 6.6 on Q2, is there any sort of thought that this might increase again by Q4?
I think given the winter pressures, so I guess just going through the kind of drivers which may increase the overspend would be the winter pressures, obviously, as well as Omicron. So we're not sure. I mean, it's pretty uncertain, but looking at the numbers of infections daily and the number of entering hospital and also being discharged from hospital to free up hospital beds, they may well be that additional pressure. I think the government have announced kind of short-term funding to hopefully support some of that. I think that's what the workforce funds, both tranches. We're not sure if there's any other funding which may help relieve some of that pressure, but I think it's kind of difficult to say, but there is a risk that it may increase.
Yeah.
I'll pass you over to Beverly. Thanks.
Yeah, thanks, Sean. So just to re-emphasize, the short-term funding that the government gives us, it has to be spent by the end of this financial year. That's always a sort of condition of the grant funding. So it is really challenging, because what we are seeing is the complexity of care that then goes on to long-term needs, certainly increased following wave one, previous sort of phase. So I suppose I'm just reiterating the uncertainties in the system. We don't know the impact of Omicron. We haven't got enough information to know what the severity and the impact may be, and how that will have a knock-on effect on long-term cost of care packages. That takes us beyond the end of March, which is when all the sort of government grant funding has to be spent. Thanks.
Okay, thank you. So I think I've understood that we know there's a significant pressure now on the adults and health based budget because of the pressures that we've just said about the 6.6 million. And we've got the savings that we need to make as well, and we'll come on to those, I think, now, because I think that's probably a good place to look at those. But I think it's just quite useful to have that in our minds as we approach the savings proposals. So I'm suggesting we do the savings and then do capital. Is everyone happy with that? If we go straight on to the savings. Okay, so the table for savings proposals. We've got descriptions of revenue growth, which we can probably go through first. And then we've got the savings. I'll leave the capital, which is on page 69. We'll come back to that. And we'll go on to page 71, which is the MTFS saving tracker, which is the actual saving proposals that we've currently got that are ongoing. So there's no new ones, but these are just the ones that are continuing year by year. And these are the ones that are currently forecasted for £3.16 million savings for this financial year. So we'll just quickly go through because that'll probably be helpful to take that. The descriptions of revenue growth. So that's on page 67 for everyone. So I hope everyone's got that on their packs. So I'm just going to go through those three areas for panel members. If there's anything you wanted to ask about the descriptions of revenue growth. So this is money going in.
67, we'll start with revenue growth.
Yeah, page 67. So I'm going to ask the first question before I see any hands up. I can't see anything. There's the adult social care purchasing budget, demographic, etc. I noticed there was 1.4 million 2022-23, but there's nothing for 23 to 25 and those 2 years, and then there's subsequent figures against the column. So I'm just checking with either maybe Charlotte, because it's purchasing, I don't know if it's, or Beverly or Josephine or Sean. There's quite a few of you now, so I don't know who wants to take that one up.
Hi, Connor. Sorry, Councillor Connor. I'll take this one. Thanks. So the reason why there's blank spaces in 23, 24, 24, 25 is because they've already been built in. The growth has already been built in our previous iteration of the MTFS. So in the previous, we would see similar amounts to the 2.7 and 2.8 million already built in. Likewise, in 22-23, we would have had roughly around 2.7 already built in, and the 1.4 is in addition to that 2.7.
Oh, I see. So you've added in this, for the next coming year, you've added in 1.4 extra. Okay, so, and the other figures are already built in, but they were already built in for 22-23, and this is an extra 1.4, is that correct?
That's correct. So they've been built in 22-23 to 25. They weren't built in 25, 26, 26, 27. That's why you can see this.
Sorry, Sean, the sound's really poor. I'm really sorry. I didn't quite catch that, but I'll just ask a quick follow-up question. So if we've had to add in 1.4 million in 22-23, what's the risk if we don't add an extra amount in on the base budget, the one that you've already said is already added in and increased for 2022-23, sorry, for 23-24 and 24-25?
I think because those are future years, we still have time to review, to look at what our financial position is next year, and then either highlight it or build it into the budget for future years. So they would be addressed in the next iteration of MTFS. Okay,
so it's not that you're not going to, it's just that you haven't allocated it yet. Fine, okay, that makes sense. And the violence against women and girls, I was going to ask, so you've got the extra money coming in, is that again going to be built in? Because this is an extra amount, and I know it was really positive to see the new staffing positions in the report that we just had recently to our committee. So do we need to keep that extra amount to pay for the staff within that? I wasn't sure what the 582,000 was for, whether it was for extra staff or it was for anything else.
So shall I take that, Councillor Connor? Hi, it's Will here, Director of Public Health. So that money will be recurrent throughout the MTFS period. There won't be additional money on top of the 582. So it's quite a complicated picture in terms of the funding of violence against women and girls, because clearly there's already some funding going in through various different grant sources. What this money will give us is additional funding, but it will also give us a firm footing. The money is intended for commissioned services, primarily to enhance and support our service for survivors of domestic abuse through our independent domestic violence advocate service, which we'll be recommissioning later in the year. There's also provision for investment in perpetrator programs and to support some of the work we're doing in the education sector. In terms of staff, the current staff are funded through various different funding streams, and we'll look at it in the round, but we intend to keep current levels of staffing in terms of positions being filled.
Thanks, Will. Okay. It's different, yeah, it's different. So thanks very much for that. That was really helpful. We're going to skip over the capital programme part because we'll come back to the capital. And we're going to go on to the savings tracker, the MTFS savings tracker for 2021 all the way through to 2026. That's found on page 71. And there's a RAG rated chart just above and to the side to say what's happening with all the different savings proposals. So I'll look to panel members if they've got specific questions they wanted to raise around individual areas. I'm going to Councillor Bull.
I have to say that in the current climate, given the impact that COVID has had on so much of the population in terms of isolation, people being locked down at home, living on their own, and all manners of what have you, I'm really, really concerned of any proposal that suggests that we should be reducing or making a saving or whatever phraseology we want to use within mental health. I understand that it says working with our delivery partner, BEH, Mental Health Trust, Clinical Commissioner Group, enablement pathways for mental health and to ensure the support. I'm not going to read it all, but I need to know a little bit more about this and whether it is a genuine efficiency saving or whether it is a cut in service, because I would be really, really concerned if it was a cut in service, given that there's been acknowledgement across the public health sector, across this country, within Health Education England and Public Health England. It's quite ironic that the government announced that they're scrapping Public Health England, and about 2 weeks later COVID comes along and all of a sudden Public Health England are back in and helping out. But I know they're being dissolved quite soon. But the concern that I've got, and it's certainly felt across this country, is there has been a severe impact on mental health caused by COVID. So I want some reassurance that this is not going to add to that. I got there in the end. Thank you.
Who'd like to take that question?
Yeah, I don't mind taking it. I can keep it short, Councillor Bull. I can certainly give you that assurance. These are not cuts to service, these are improvement pathways for people who use our services. And it's much as the narrative actually says. You know, we are fortunate enough to have transformation funding, which supports the development of these new pathways. It means working in partnership with partners, voluntary sector, etc., etc. But fundamentally, I think, as Councillor Dasnev said earlier, it is about improving the quality of life and improving outcomes for people who use our services. On mental health, it's worth noting that, and maybe Will might want to say a little bit more about this, we've actually been able to attract additional funding to support the mental health and well-being of our residents. They call it the Great Mental Health Fund. And I think that's partly as a recognition of the adverse impact that COVID has had on residents. And there are some proposals that have been co-developed to look to see how we can support people in our population.
Thank you, Beverly. I've got Councillor Dasnev.
Come in, but I don't want to steal Will's thunder. I think we've actually made mental health quite a priority within the authority for all the reasons that you've said, Gideon, and more. And actually one of the things that we'll be doing in January, and I know you will have had an invite in your inbox, is having a real focus on mental health with a Great Mental Health Day, with resources and support and sessions for residents, and the invite in the councillors' inboxes, and I hope all will be able to attend, are for sessions which both look at councillors' mental health, but also how we can better support really good mental health in our communities, and helping us understand all those kinds of pathways, but also all those services that are out there and the resources that we've got.
I don't think you were you? Sorry, I don't think Councillor Peacock wasn't mentioned, was she? Councillor Dasnev? No, I think. No, sorry, I was thinking, I don't remember that. Okay, thank you. I'm going to ask a general question on the savings tracker. I think I'm just looking at it now. Well, obviously have been looking at it. The savings haven't been achieved in quite a number of the areas. There's a number of them with 0 against them for the savings achieved year to date. Whilst there's, especially on things like client contributions at AS102, I like the way it's 0 up to now, but suddenly going to be the full amount by the which is projected savings by the end of the year. So I'm just going to ask, really, a lot of these are amber or red, other than the physical support. So I think I ask this every year about the confidence of the savings being delivered. I think I know what the answer is, because I think I get the same answer every year, but I'm going to ask it anyway. So what confidence do you have that the projected full year savings column will be correct, and we won't be on the second column, which is the savings that are actually achieved at the moment? Thanks.
So I can start, and maybe Jenny, you can come in with some more detail if you want. So obviously the savings tracking is a really important part of our business because we like to be assured how well we are doing. So they are very regular sort of monitoring and reviewing systems in place that Jenny actually oversees to make sure that we are tracking the achievements as far as possible. And that's why the sort of the amber green sort of RAG rating is really useful. So what you've got on the table is the projected full year savings. If we start with, let's say, mental health. I start with that because you can see the savings achieved year to date is 146, but yet we have a certain level of confidence that we will achieve the projected full year savings by the end of the year. And the reason why it's still at 146 is that we had a late start, again because of COVID and the impact of that on our operations. Mental health was very late in the year in terms of starting to develop those outputs that would contribute to savings. However, once they did get started, they're really motoring. So we still have a high level of confidence that the full year savings of 490k will be achieved. And just to remember that this is in terms of improving outcomes for individuals, which means that they don't need as much high cost care as they did previously. So the whole enablement pathways, which we could look at as the sort of the parallel to the sort of physical reablement, is something that was fairly new in mental health. But actually, what we've seen to date since this sort of late start is that is showing improved outcomes for individuals. I use that as one example. Another example is client contributions. Again, that's where we're recording a zero in terms of the savings. But actually, I think we have to remember, because of COVID and the restrictions that imposed, we were not able to actually conduct financial assessments at the pace that we would normally do so. But however, since we've been up and running, and again, Charlotte may want to come in here, we actually feel that we are fairly confident, not as confident as my previous example, because it's still rated red, that we will make the full year savings. And I would say the changes we made to our system in terms of fast tracking financial assessments, and I think we might have said this last year as well, where earlier in the sort of the pathway, the interaction with the client, we talk and we actually carry out financial assessments, means that we have a greater opportunity to ensure people get the right information at the right time, they know what they're signing up to, and therefore we are able to then collect the financial contributions, the client contributions, as appropriate. But I think these are sound policies, but I think the challenges of COVID restricting how we have been able to work has impacted on the sort of trajectory. I don't know if Charlotte wants to add anything.
Sorry, I'm just going to come back on that, Beverly, sorry, before anyone else comes in. So other than the fast-track financial assessment, the client contributions, which have come in more recently, I think, going back to the Haringey learning disability, mental health and transfer of high-cost daycare, I'm just wondering, as you get closer to, obviously these figures are going down because you're achieving some every year, you are making some savings, but as you're getting closer to that zero, I'm just going to ask, is it getting harder to do? Because are you getting to that core cohort of people where actually, for whatever reason, this is more complicated? So, you've made the initial savings, but you're getting now down to a certain, core level, or, there's last bits. And I'm just wondering if there's a opportunity maybe to sort of rethink or do not rethink, but re-examine the sort of the nuances of these individual schemes to see if this is an issue within that. So is this a risk to your savings? Because there's obviously, I know we talked about COVID previously and obviously this time, but I'm just wondering if there is anything else that is a risk factor within these savings that you're trying to make that is keeping these in amber, and actually every year you're not actually making the full savings, there's always slippage. And I think I'm correct in saying that year on year there is slippage. Anyway, so yeah, over to you.
No, I think that's a good question, Councillor Connor. I think last year, and correct me if I'm wrong, Sean, I think despite the challenges of the year, we achieved over 80% of the savings.
Yeah.
So last year, which was a very challenging year with the start of COVID, etc., we achieved over 80% of savings. I think what that reinforces for me is that our strategy is right. I'm not going to repeat the strategy because we outlined it earlier on. The strategy is the right one. And again, it was developed following lots of support from experts in the field and looking at other authorities and the way that they actually develop their savings, but we try to make it right for the Haringey situation. So we successfully bid for transformation funding to develop these pathways and support people to have those improved quality of life options. I think in terms of, is there a risk? We regularly monitor.
Sorry, Beverly, you've been cut off in, I'm sure, a very important last part of your information you're going to tell us. I've got Councillor Peacock who wants to come in with a question, and then see if we get sound back. Thanks.
Can I just finish, Chair? Just in terms of the monitoring.
We're not hearing you, Beverly. I'm really sorry. I'm going to give it a few moments to see if because sometimes it just seems to be coming back in and out for some reason. So I'm just going to let Councillor Peacock hold your thought. You can come in back in. I'm just waiting to see if your sound improves, and hopefully someone else can answer Councillor Peacock's question in the meantime.
What I'm interested in is PAG, transfer of high cost day ops, leasing 3 ex-day centre premises. Now, one of the, I'm sure the Grange is one of those in my ward, has been closed for a couple of years now, much to the distress of the people that used to use it. Is that one of the 3 that are going to be leased? And what are the other 2?
Charlotte, do you know
Yes,
this?
thank you. I don't think it is the Grange, Councillor Peacock. I will double check, but I'm pretty confident it is not the Grange. I think this relates to a previous set of proposals around the Chad Gordon Autism Campus. So the 2 provisions at the Haven and formerly known as the Haven and the Ramway, now known as the Chad Gordon Autism Campus. So it's a small, as you'll see, it's a small contribution, but it just offsets some of the costs. But the Grange was not one of the 3. The third one, which was always a little bit of it got stuck in there, as it were, was the Woodside Day provision. And was the third one.
Is that the one in White Hart Lane?
Yeah, when we talk about the capital works,
I'm
there.
sorry, because the sound is very poor, Charlotte, I didn't hear the name of the other centre. I just couldn't catch it at all. So you say it's not the Grange. It is Woodside.
You're right,
and
it's Woodside. And the other 2 are the former Haven and the former Roundway, which are now the Chad Gordon Autism Campus.
Yeah, on the corner. Yeah. And the last one?
They're the 2. Councillor Ball has used Waltheoff Gardens, which we always used as a shorthand. We're trying to call it the Chad Gordon Autism Campus now.
I used to go there quite often when I was mayor. They used to invite me there all the time because there was like a nursery in part of it.
Very good. I think Sheila's just asked one.
Yeah, sorry, can I just see if Beverly's got her sound back? Because I know she wanted to come back in. So Beverly, if you've got your sound back, please finish what you were saying, and then I'll ask Councillor Bull for his question.
I think I was just going to...
Councillor Connor, I think you need to turn your...
Okay, can you hear me now? Yeah? Okay, it was just to emphasise your question about risk and how will we know if we're going to make it. And I was just going to say that we have a very good system that Jenny manages that regularly. Is it fortnightly, Jenny? I don't know if you want to say a little bit about that.
Yes, so we have regular meetings with all the heads of service. We have them fortnightly, and then we also have monthly meetings whereby we look at where we are. This also includes any income we're getting as well. So we're really, I mean, as Beverly said, basically we follow the strategy. From the beginning of the year, we follow the strategy, and we make sure that in order to achieve the savings that's allocated to the various areas, we also review the resources that we need, the staff that we need, and what is the kind of staff that we need. We make sure we put those in. We make sure that we try and load those at the front of the year as well, so we get a full year effect.
Thanks, Jenny, and thanks, Beverly. Councillor Bull, did you want to?
I do. So I'm looking at page 72 and I'm looking at AS 101. Can you explain a little bit more about what this actually means? Because it looks like we're trying to get money out of people that we didn't get money out of before, but now we think we can get money out of them now. And it can't be that simplistic, but for £1.5 million and a bit, it seems quite a lot of expectation of getting money out of people that we couldn't get money out of. And in addition to that, this fast tracking financial assessments, and I'm sorry to be really flippant, what does that mean? We're going to type faster and just go faster to get the assessment through? It doesn't make any sense, because I think some of the aspect of the financial assessment surely is dependent on external variables that we don't have any control over. So how can we fast track them?
Shall I take this one, Councillor Ball? Thank you. So this is a bundle of things which are designed to help us to be more efficient in our client contributions. It's not charging people who wouldn't previously have been charged. There's no change to policy. It's just doing it in a more efficient way. So, for example, if we, when we first do assessments of care needs, we're also talking about the fact that people will need to have a financial assessment. So there's paperwork that needs to be got together. As you say, there are matters that are completely outside with our control, but relates to people's income, whether they're, from a whole raft of areas. We still operating within the existing non-residential charging policy, and we have a residential charging policy as well. So it's just about doing that more efficiently so that we don't leave long gaps where people think they may not have to make contributions, where they're not making contributions. And then obviously if people have got into, in effect, a debt against the council, that's obviously more difficult to recoup, and it might mean that we need to write that off if it's not possible to do that. So these measures are all designed to have a more efficient approach to make sure that we review people's circumstances change, their pension income might change, their outgoings might change, so their level of savings may change, so people fall in and out of being eligible for client contributions more easily than people might anticipate. So it's just being alert to that so that people who still can afford to pay are paying. We're not bringing we're not changing the terms of the policy, if that makes sense. In terms of fast track, yeah, I mean, obviously we all want everyone to write as fast as they can and work as hard as they can, but in effect, we want people to work as efficiently as they can, and that sometimes means taking a bit more care and going a bit more slowly, but that's the upshot.
Just for the benefit of the thousands and thousands of residents who are obviously watching this meeting tonight, most of which live in White Hart Lane Wall because they want to see their council actually doing something, can I ask, the only thing I get a little bit concerned, this is a serious point, the thing I get a little bit concerned about when I hear about, are we going to do it more efficiently, is someone turns around and says, well, what were you doing before then? Why were you so inefficient before? Would you have made yourself more inefficient? Is the only reason you're making yourself efficient now because you have to make a saving? Just explain a little bit more, Charlotte, about how we've got to this situation where we are making ourselves more efficient. And because I don't want people watching us to think that in the past we were just throwing money around like a man with no arms.
So I don't think we were throwing money around. I think it's important just to note that there has been a hiatus when we weren't collecting client contributions because of COVID. So just, to Beverly's point earlier, I think it's quite important to recognise that. And so this is sort of having to kickstart where people weren't making client contributions for a period in light of the pandemic. But yeah, previously we just had a slightly different model, and it's partly with the benefit of benefit systems being digitised, a lot more stuff being available online, being able to converse by email in ways that we weren't before. So it's just mean that other things around us have sort of sped up some of the systems, which helps us to be more efficient. And it's just recognising that actually, I think the practice point of view previously was to have a conversation which didn't get into whether people might be needing to make financial assessments, but actually then it might mean that people had a different response to their package of care once they'd had a financial assessment. So actually bringing them together is a much more real conversation about the sort of nature of need and the nature of the practice. So the practice has changed around it as well, and felt that it is actually beneficial for people to see things a bit holistically and understand that for social care, unlike obviously for the NHS, it is a means tested provision. Hope that makes sense.
Okay, I'm going to ask one quick follow-up question on that. Following up on Councillor Bull's point, it does say on this description, it says reviewing clients' potential eligibility for charging that had not previously been assessed. So are we, I think going to the serious point is, are we sort of looking further down, you know, to the people who may be right on the sort of borderline of whether we'd have charged them before? Are we looking at that cohort of clients and saying, well, actually, yes, we can charge? I mean, who are these people who'd not previously been assessed?
So those would have been people who'd come into need during the pandemic, and they were not liable for assessment or charging for that period. So it's not that we're reaching out to a different level of person. It's that they would not previously have been eligible for charging because there was a I can't remember the phrase. I think it was it might have been the use. The DHSC introduced an exemption from charging and therefore an exemption on client contributions from the council. So they would not have received a financial assessment if they'd come into care need at that point.
Okay, because wasn't this brought in pre-pandemic, a year or two before the pandemic? So wasn't this a savings?
This was done from
previously?
last year. This was from last year, wasn't it? I think
this saving line has only been from last year.
Well, there's been a bundle of packages around. Sorry, it's really echoey. I can't think with it echoing. Sorry.
Charlotte, so I'm just
could
querying.
You just put it on mute? Could you just put your microphone on mute, please? Is that possible? Okay, so thank you. So yes, I mean, we reviewed it again last year and added, but there were a bundle of packages around client contribution. But the other point is that people would have had an assessment and not been charged, and then they would have been brought into assessment. But there was a practice of everybody who came forward for care being assessed. So it's not a new reach to people who weren't previously assessed. So it's not a change in policy. It's not reaching out to people who would have been on low income, because we don't know that until people have had a financial assessment. We don't make assumptions that somebody coming forward to in any particular guise has a certain level of income or a certain level of savings. So we cannot know that until we've carried out a financial assessment. A financial assessment doesn't necessarily lead to a finding of requirement for a client contribution. That depends on the set of circumstances in which they're in.
Okay, thanks, Charlotte. Okay, so looking back at the savings tracker, does anybody want to make an individual recommendation around a specific area? Well, you can make some now, or you can do some after. I don't mind. It's if you've got any areas of thing to highlight now, and then we can just put that.
I'm still a little concerned about because it seems that AS 101 and AS 102, the explanation for those are the same. Okay, so far. And AS 102 is in red, which leads me to infer from that they are going to struggle to make that saving. That's what that means, doesn't it? It doesn't mean that saving is going to have a red effect on the service. It means that they're struggling to make the saving. And I would I would really want to see both.
Can you hear?
Yeah,
I think we've lost them. I
can't hear anything.
We've lost them.
They've gone.
Frozen.
Right in the middle of a recommendation.
I think we might have lost the room.
I think we have, you're right.
We have.
Did you?
Oh, Dominic, are you on here?
Sorry, everybody. We've had got some difficulty with the connection here. We're just trying to sort it out. We'll be with you shortly, hopefully.
I went to
Thanks.
one year. She said, "Oh."
I could ask a question while we're here, while we're waiting for him. Charlotte, is it red?
A sensible question.
Yeah, well, I can try. I mean, I can't guarantee. I'm always a bit 50-50, aren't I? I'm sorry about that. That AS, I can't, 10, whatever it is presumably be red because we hadn't done anything before. So we started in a kind of quite bad place, not because we'd done anything wrong, but just because we weren't doing that. Is that right? Is that why it's red?
No, I think
it's quite hard to do.
Well, I think it's because, and now I'm getting confused with my timings, and Councillor Collins asked me that, but I think because the client contributions we didn't take client contributions for any period from March 2020 through to.
That's what it is, Charlotte. That's what it is.
Yeah.
And then what we also did was actually come to think about it now is because we did that bid as well, didn't we? To get some staff in to do the backlog, and because it's.
So,
but also
because there was a period of exemption, there was a technical. I was trying to remember this sort of legalistic.
I can't remember
term
it. Basically, you could not
prescription or something like that.
You couldn't. We couldn't do the financial assessments because you couldn't take a client contribution during the period. But also, as well, to be honest, the staff were redeployed into other areas as well, weren't they?
Yeah,
actually,
true.
during COVID, it's kind of like been so long ago now. It's all kind of coming back now.
So, but is it red because we're just not sure we're going to achieve it, or it's because it's one of the? Is it red because
no? It's red because the rating. What the rating is it depends on how much you've achieved based on the original figure. So you've got a figure for the year, and then every month we adjust that based on what we've achieved. So we've got a year to date, we've got a full year and a year to date. The rating red amber is based on the year to date. So if year to date we had achieved 50%, it might be, and actually the year to date is worked out. So it's worked out over the year. So let's say it's at 1,200 over 12 months. It's usually a little bit less, but it was 100 every month. So when you get to the 6 month period, you'd expect to have 600. Yeah. If you don't, then that's red or maybe red amber. If you do, then it's green, and if you're near it and it's amber. Does that make sense?
Yeah, no, that makes sense.
So
I guess what I was asking.
How the rating is. It's not. We don't say it's red because we think we're not going to do it, because the assumption is that we will meet them, or at least try and meet all of it, and then the rating is where we are in actually meeting it.
Yeah, and I think that I suppose that's really useful, because that's exactly what I was trying to say, which is that sometimes when you achieve something, you need to invest this much in the first part of the year, and then you do close the deal at the end. But the way we calculate it is by months, so it will look like we're failing, and then suddenly you achieve because you need to put in a certain amount of work before you get it.
And it depends when you start. Depends when you start.
The year, yeah, I see your point. Yeah, so you might not start in January. Actually, you might well start. Yeah, okay. I think that might be useful to say, actually, if we ever get back in. But that's really useful. Thanks, Jenny. No, that's really helpful.
Yeah, the other point to make is that it's a positive, because we're preventing people from going into debt. And then
It's really, that's really important points, actually.
by doing that financial assessment as early in the process as possible, together with what Charlotte said, people know what's coming, but also they don't accumulate debt, which is more stressful and more, it's a good thing.
It is because actually as well, people are given financial advice that helps them to maximize their income.
Yeah.
So that's another point as well, actually.
Yeah, no, should have said that.
That sounds great. Thank you. Yeah, no, that all makes sense.
Sorry for butting in. Is it possible to include some sort of percentages on those green, amber, red?
The percentages basically, but I mean there are percentages sort of. Sorry, percentages as to what? As to when we think they'll be green?
Yeah, I
or
mean, say for
percentages
example,
as to the how much is achieved.
Percentages to how much it is. Well, say in I don't know June it is 20% of the total. Then it goes up to I don't know. In September.
We do have percentages on those.
Is it on the table itself or?
I don't know if it is. Sean, is it on the table itself? Because we do have percentages of where we are in meeting those targets, don't we?
I don't think it is, Jenny. It's not on the table.
It's not on the cabinet report.
It's not on the cabinet
probably
one, but
something we hold. You know,
it's certainly on ours, though, isn't it?
Yeah.
Josephine and Sean, it's certainly on ours.
Yeah.
But it would have been quite useful actually if it was on the table itself.
It might be something we can include in future iterations.
Yeah, we can feed that back to our corporate colleagues who hold the rein on all these papers.
I think it sounds like as well that we might need to explain the rating.
Yeah.
Because I think people don't quite understand the rating. So, which I've just realised that that's what they think the rating is, but actually the rating is how much we've achieved based on our where we are year to date, as opposed to amber because we think we're going to achieve it all, or red because we think we're not going to achieve it all. I suppose it's how you look at it, but certainly that's not how we're looking at it. We're looking at it in terms of amber because we've nearly achieved what we should have achieved year to date.
Yeah, I mean,
or we have achieved year to date.
The colours don't explain it at all. I mean, when we say red there, that basically means it's not going to achieve what it is intended.
I can see that's what people think, but that's what I'm saying. I think maybe we need to have an explanation of what the ratings are, because that's not what it's trying to say. That's not how we're reading it, and that's not how it's presented in our monthly sessions.
I think we probably need
that's
to
not how we're
ensure
defining it. Sorry.
Other departments are using the rating in the same way. I think that forecast delivery column is trying to say we are going to deliver it. So in a way, it kind of supersedes that red. We are still saying we're going to achieve it by the end of the financial year. But I can understand where the confusion lies.
Yeah, and that forecast delivery, So when you look at what we've provided, it doesn't. Do you know what's made me think as well? Just thinking of Ali coming in there as well. As I remember one of the first things that happened to me when I became chair of Overview Scrutiny was that we had a briefing about the wheels at the time, the wheels and the colours and etc. And look, even me, I'm not quite remembering. And we might have discussed that. We might not have, because you're right, other teams might be using things in a different way. But it just makes me think that that's something we should maybe be covering off every year. Just a quick kind of reminder of what these things mean to us, how we use them. Oh, it looks like we might be going back in.
Hello, are you there?
We are.
Hello.
Hello. Did you hear us okay? Did they hear us?
Okay, thank you. Apologies for that. We had a issue with the computers here at this end. So it's great to have you back. We're going to go straight on to capital. You'll be delighted to hear. So that's on page 43, the Council's capital strategy and capital programme. So we're sort of going back a little bit, just have a quick look at the oversight of the capital strategy, and then we'll go straight on to the adults and health. So we're just, any questions on the capital that was in the papers? I'm just going to check with my colleagues.
Apologies. Can somebody just let me know what the Mosaic system is, please? Thank you.
Hi, yes, it's Jenny Plummer here. The Mosaic system is the client information system. It's the adult social care client information system. It's also used by children's as well.
I'm sorry, could you just repeat that?
The Mosaic system, hi. It's a client information system used by adult social care and children's. It's Haringey's client information system, the information that we keep client information on. So the case files, it's also a financial system, so care packages, documents, letters, case notes.
Jenny, is it part of the MASH, the multi-agency?
No, the Mosaic is it's an IT system where we keep the information instead of a file. It's the computer system called Mosaic.
Okay, thank you. That's answered that question. Thank you very much. Okay, any other questions from colleagues on the main part of the report on capital? Okay, so I'm going to ask, I'm sorry, this is probably a question for Josephine, if she's still on the call, or Sean. So this is a question on page 45 on the capital expenditure plans for the general fund account. So we've got a total amount of £818 million by the end of 2027 on page 45 and table 8.1. And then, Sean, we've got a table at 8.8, which says the financing cost for the general fund in 2026-27 is £29 million, which is 10.24% of the proportion of the net revenue stream. So the question that I have is that if the capital, the general fund account, the capital expenditure plans within that go ahead and go to plan, then we are going to be, am I correct in thinking we're going to be paying back, and I'm assuming the £29 million is interest on that borrowing. Am I right in thinking that our revenue account, we will have to find £29 million from our revenue account? We've got John O'Keefe as well on the call. I didn't realise. Excellent.
We do.
Excellent. So are we going to be paying back that amount every year? On that year when we've got that much debt on the general fund account? Thanks, John.
Hi, good evening, everybody. Firstly, it is both interest and principal repayment of debt. So it's not just interest on that sum of money, and it is in the base budget, and so we will continue to pay that debt and service that debt for a period of time.
Right, so we will be paying £29 million, and then if we spend more, so going forward from 26-27, if we spend more in the general fund account on capital expenditure plans, obviously that debt will increase. So the question I have is, can we afford to take £29 million from our general revenue account, having heard tonight the pressures on the account and that we're already having to put money into the account from the reserves in order to make sure that we can balance the books at the end of each year?
We have those numbers are in the MTFS, so they represent choices that we have made and are making going forward, and that's the cost of repaying the debt. It's open to the council to cabinet to balance the investment needs of the borough which gives rise to a revenue implication against the other revenue calls that we have that you've been discussing tonight and have been discussed at Children's Services and Environment and Neighbourhoods on all those other scrutiny panels that we have. And like all of the numbers and all of the budgets in here, these are choices that the authority is making through its budget setting process.
Okay, so that was a yes, isn't it? That we're making that is the amount of money where we're going to be. That's the pressure on the revenue account. I think my concern is that in that year it'll be just over 10% of the proportion of the net revenue stream will be going to service the debt that we will be holding in the capital. So my concern is, A, if we increase that, we're going to increase the proportion of the net revenue stream funding that we are using, and then that means that we have less for the revenue for the services that we've been discussing tonight. So adults and health service, we've been saying, well, we need to make, or there's a £4.1 million saving we need to make. We've had growth pressures discussed. I'm just trying to work out how this tallies with the overall budget. How can we say, well, we're going to be spending that amount and yet saying we've got a potential gap in our service revenue stream? I think, was it 20 million by that same time, or 25 million?
Yeah, and there is a concern. All I would say about that is that the numbers that you have here, the estimated costs of the debt servicing, if you look at our capital programme, there's a huge investment going into school facilities and buildings. There's lots of investment going into the public realm and the infrastructure, all of which are required and all of which are choices that are being made. So the decisions around the capital programme that we have and that are going into the capital programme in this coming financial year are all choices that have been made and now reflected in this budget here. Obviously, choices could be made differently, and so one could take money from one area, save the money, the debt charges on the capital programme, and redirect that elsewhere in the revenue budget.
Okay, I can see oh, sorry, I thought Councillor Nev's hand was up. Apologies, did I get that wrong?
No, I was going to come in, and then I felt like John had covered it, which is really to say we make choices, and there are certain kinds of capital projects and certain kinds of investment that we might expect to make, and we suppose we might have the flip criticism, which is if we weren't making those investments, we wouldn't be investing in the infrastructure we need. For example, we've had projects like Canning Crescent, Osborne Grove, etc. Those are all things that people expect, or the community expects us to make that investment in our buildings and infrastructure, and also those investments can support the revenue budget as well. So, but I think John covered it really.
Indeed, I'll come to Councillor Blake in a moment. I'm just sort of noting that we are increasing our capital expenditure very considerably to just over £2 billion in the next sort of 5 years, from I think it was about 500 million we started previously. So it is quite a considerable increase in a very short space of time. And I know, John, I've raised this with you before as a concern. So you'll have heard me already ask this, I think, last year. So yeah, over to you. And then I've got Councillor Blake. Thanks.
Just to say that the numbers that you're looking at in table 8.5, they include the housing revenue account. So this is the effect of all the activity that we have in housing revenue account, the refurbishment, renewal, the new homes that we're creating. So those come at a cost, and one of the costs is that we have to service the debt to do with it. Now the HRA business plan, and the HRA is ring fenced, so that sits to one side, and those schemes only go ahead if they are supported by a government grant and being able to pay the interest charges on the debt incurred in creating new properties. So from that number, you're right, it's a very large number. A big proportion of that is in relation to the housing revenue account.
So I've got that 31 million is in relation to the housing revenue account, and 29.3 million is in relation to the general fund. Is that correct?
Well, the comment I was making was looking at table 8.5 to say that it's 2.256 billion, and that's a combination of the housing revenue account and the general fund.
Yeah, sorry, I was just sort of simplifying it out to see what the actual cost was to the council in financing those. And sorry, that's table 8.8. You're right, I did use that 2 billion because that seemed to be such a large figure in from previous, we spent, was it 500 million in 50 years and now potentially up to 2 billion in 1.5 billion in 5 years. So I think I was just making that as an observation, but I think it was just the proportion of the financing costs. And you're right, the HRA is 31 million, and that's separate, and that's in table 8.8. Councillor Mark Blake.
Yeah, thanks, Chair. Yeah, I was just going to reiterate some of the points I think officers have made, which is that, I didn't have any concerns looking down this list because a lot of these were projects that have been in progression for quite a while, and the majority of them, if I look at the assistive technology, for example, hopefully they should all be saving us money. And I was going to make the same point on the HRH, the housing revenue, sorry, the HRA issue as well, because but I think the principle sort of applies to a lot of the general fund investment, is that it should be saving us money. Obviously, there's a concern, and you're right to raise the concern in terms of the proportion of money that's going to be servicing debt, particularly, when there's lots of talk of raising interest rates and all the rest of that. But actually, in terms of a principle, I think it's right if we're investing in schemes of this nature that hopefully are going to keep people away from that acute end of the service. Thanks.
Great, thank you. So we're going to move on now to the capital, which is the draft capital programme on page 69. That's Appendix E. So this is where we go through each of the areas that Councillor Blake, I think, just began to refer to. And I know that Councillor Bull had a question on, I think, the aids and adaptations, which is the scheme reference 201. So I'll pass over to Councillor Bull.
Yes. It was more, this table is just giving me grief. Right, I'm all right now. It was more just a little bit of information about how, I don't want to get into a huge discussion about aids and adaptations, but I know that there's aids and adaptations that the council does through adult social services, but then I think there's also aids and adaptations that are done through Homes for Haringey. And I just want to get a better understanding, given that the Cabinet have recently agreed to bring, or to start the process of bringing Homes for Haringey back in-house, whether there are efficiency savings that can be made in aids and adaptations in the way that we actually do the aids and adaptations and the way that we manage our aids and adaptation stock. Now, I know it's quite a difficult thing, so I'm going to give you a very quick scenario. I've got a resident in my ward who did a transfer. Okay, but when she initiated the transfer, it was about 9 months before initiating the transfer and actually moving into the property. And in those 9 months, it's a mother and a daughter. The mother, her health deteriorated quite substantially, which meant that when she moved into the property on White Hart Lane, which was a 3-bedroom property, it needs quite a lot of aids and adaptations done to it. The lady is stuck upstairs. The suggestion for a stair lift, a wet room, this and that. Now, when all that work gets done to that property, and God forbid when the lady passes on, what do we do with that property? Does it go back into general reletting, or do we have a pool of aids and adaptations properties that we then put someone else in, or do we reverse it? And have we looked at what other local authorities are doing? Because this looks like an area where we could really do something quite, strategic in terms of maybe trying to have a pool of properties that have had aids and adaptation done to them, because some of them, and from my experience, and I'm sure other councillors are the same, they've had quite a substantial amount of work done. Now, I know you can run the risk of having the property left empty, and that's obviously not something we want to do, but I'd rather have it empty for maybe 6 weeks to 2 months, rather than have to go in and take all the aids and adaptations out. And I don't just mean a couple of handrails to get you in and out of the property and to get you in and out of the bath. I mean, quite substantial work being done. And that's always been an area of concern of me. And as I've got much more involved in casework even more than I was before, it sort of jumped out of me as something we might be missing a trick. Help me out and tell me if I've got it completely the wrong end of the stick. So Beverly's itching to come in. Come on.
Thank you very much, Councillor Bull. I suppose I just want to agree with you. I think your original premise, the insourcing of homes for Haringey and looking at how we can work more collegiately together, particularly around aids and adaptations, is something we've already identified as an area to look at. I think we've already got meeting dates in the diary, haven't we, got Jenny, with our Homes for Haringey colleagues to look at, how we can improve the efficiency and the effectiveness of what we do. I think it's also important to note that in terms of adaptations, we've started through the work Charlotte is doing with our housing colleagues, looking at new builds and how they can be adapted at the point of design rather than retrospectively, doing the aids and adaptations. That's a fairly new step that we started taking as well, but it does enable us to meet specific needs of individuals. I'm not very technical in this area, but I do know, Councillor Ball, that adaptations are usually quite specific to the individual and their needs, and there's that specific occupational therapist assessment, which means that one person's adaptations not necessarily meet the needs of another individual. But I think you've made some really valid points, and these are all considerations that we've already got lined up to look at in terms of the opportunities arising from the work with Homes for Haringey and the insourcing.
And hi, Beverly. Can I just come in as well, please, Councillor Connor? So I think, Councillor Bullin, also you're talking about the properties that we have adapted. So that's also something we're talking to Homes for Haringey on, because we do think it's wise that we could maybe try and have a record of what properties are adapted. I mean, Beverly's right in that adaptations are specific to the individual, but maybe things like knowing that a property has a walk-in shower, for instance, could be something that we're very clear about, and we can know that we have certain amounts of properties that have a walk-in shower or a downstairs shower or a downstairs bathroom or something. So those kind of things could apply to maybe a wider group of individuals, as opposed to other adaptations, which are very specific, depends on the disorder or the mobility of the person.
Thank you. I'm just going to pick up on Councillor Bull's point, just to elaborate a little bit more. I noticed when we had our quarter 2 position given to us, that the 2021-22 budget was 3.5 million for aids and adaptations, and I note on 22-23 it's 2.1, and going forward it's a similar amount. I'm just wondering why there's a drop in the that spend on the capital programme, especially because it's got externally funded here, which I always think, oh, that's not Haringey funding it. So I'd just be really interested, because my area of concern is that I have residents who don't have access to aids and adaptations in a timely manner, and are significantly affected by that, especially if they or one of the family member has a significant disability. So I'm just wondering why we've dropped that funding in that area. And I've got John's hand up.
Yeah. The current budget for this financial year includes a carry forward from the previous financial year when we underspent. Because of, for obvious reasons, we were not able to do as many aids and adaptations as we would have wanted to. So that's the reason why we was carried forward money from the previous financial year into this financial year, and the 2.2 million or thereabouts represents our estimate of how much we'll be getting disabled facilities grant through the Better Care Fund.
That's where the money comes from. Thank you, John. Okay, so I've got other schemes that I wanted to ask about. I've got Osborne Grove at scheme reference 214. In 2023-24, we've got a budget of 34 million to be spent over that year. That's quite significant compared to the other years. Do you think that's a realistic ask to get that money spent in that time frame, or do you think it's a little bit more realistic to think that might go over into 2024-25 budget?
Would you, Charlotte, would you like me to answer?
John. Yeah, John.
Or Charlotte? Charlotte?
John, you go first. I'll come in if there's anything you haven't covered. Thanks.
Okay, yeah, I mean, the budgets that we have, especially with some of these larger projects, have been set a number of years ago. And so because of the way that the projects are developed, they do sometimes get out of line. We do review these budgets on a regular basis. And what we'll be doing now, between now and the next time we go to Cabinet with the budget, is we'll look at the current state of play of the Osborne Road Nursing Home project, and we'll see whether or not we need to revise the cash flow that's associated with that. And that's it's a perfectly normal thing and regular occurrence that we do with lots of schemes. So I think the answer to your question is probably it's unlikely that we would spend that amount of money in that financial year.
Okay, thank you. I think those were my questions that I had. Oh, one more on the 218, social, emotional, mental health provision. I wondered within that budget, because Haringey is down as a source of funding, or Haringey borrowing within that. Do we know what proportion of the 600,000 is Haringey borrowing on that?
1 second.
Thank you.
Right. Our borrowing, pure borrowing, is around about £300,000 of the overall cost of 1.8. We've assumed that about £500,000 we will borrow, but we will find and generate savings in order to pay for that borrowing. And the balance of £1 million we've identified provisionally as being a contribution from partners, specifically health, towards individual projects. And we have a reasonably good track record with health of generating capital contributions. It's easier for them to do that than to do the revenue. So at the moment, those are just sort of planning assumptions that we had behind this. It may not be the case that we end up with those exact proportions when we go through, but each spending decision within 218 will be subject to a business case to prove that we are going to generate the savings and to support the investment.
Okay, thank you, John. That's really helpful. And I'd just like to say thank you to Charlotte, who has given us a more detailed understanding of the capital programme outline of activity, because it was my understanding that on the paper it said there was no new capital spend. However, there are a significant amount of capital projects which I hadn't understood the depth of until I got the paper. Did you? Okay, it should be on your desk. Sorry, it was just given to us quite recently, but actually that gives us a really good indication of what exactly is going on. And thank you, Charlotte, for doing that. You know what I'm going to ask, don't you, for next year, that we have some capital funding against those projects. But, you know, I always want more. So thank you, Charlotte, for that. Is there anything else on capital that colleagues wanted to bring up at this point? No. Okay. Anything, Helena or Ali? Sorry, I don't know if we haven't heard from you for a little while, so I'm just checking that A, you're still on.
We're
B,
still on. Well,
questions.
I'm still on. I think Ali is as well. There's nothing new to add to that. Thank you.
Okay, Ali, I'm just going to check with you. Have you got any questions you want to ask either on capital, or if there was anything you thought about on revenue whilst we had that break earlier? Okay. Okay, I'm going to take that as a no unless I hear anything else coming through or Dominic gets any indication. Okay, so thank you to officers. So we'll just keep Helena and Ali in the room for the recommendations that we're going to discuss now as a panel put forward. But thank you to the officers. Thank you to everyone that came on, Councillors Neves. Thank you for your time tonight. So we do appreciate it. Thank you very much.
Thank you. Good night.
Thank you.
Good night.
Good night, everyone.
Thanks, everyone.
Thank you. Okay, so I've made a jot. I was jotting down some thoughts as we went through. So discuss quickly. So one of the recommendations I was going to make, and this is something that I've been trying to get sorted for a while, is the way we have the budget pre-meet sorted and the papers given to us. So this time we had Q2 information on top of the information in the pack, which I think wasn't. I think we needed more information from the actual pack that we were going to get on the night rather than Q2. So my recommendation is that we split Q2, or we split the quarterly reports, which is all the risk and the wheels, from the budget meeting, because the pre-meet then goes on far too long because we've got a huge amount of information that we're trying to do. The second part is the actual pack itself. It's just really around formatting. So we really like the information we get on the revenue and the capital overview of the council. That's really helpful to put it in. But what I think we don't need is all the information from all the other different panels in our pack. So we've got the housing, the environment. It just needs to be removed. So we can keep the tables with everything in. So, you know, the way that adults goes with housing and you know, all the other different ones. But we don't need, I mean, we can have it as an appendix. You can have the whole cabinet report as an appendice so that you can use that as a reference. But for this meeting, when we're trying to just keep it quick, you know, sort of everyone knows exactly where we are rather than jumping through 20 pages at a time, information is a little bit scattered. Okay, so I'm going to ask Dominic to come up with some wording that's going to make that really clear, hopefully, for everyone, and that will be really useful. And also that anything like the trackers and the appendices should really be in the pack where we need it, rather than, you know, so as we go through, revenue, we deal with revenue, then we go through capital, we deal with capital. It's just formatting. Councillor Blake. Mark.
Yeah, I know you said years ago that this was kind of 3 times or 10 times the size or whatever, but I still found it kind of difficult, you know, seeing the wood through the trees with this. I just like something kind of sharp in terms of, particularly around the risks. Like I said, what are the risks kind of moving forward? You know, forget the faff and everything else. All right, you know, because I think politically, I think that's just absolutely crucial, because, you know, if the government are shortchanging us, yeah, officers can't say anything about that, but as politicians from all sides, we can certainly say something about that. So it's that kind of clarity, really. I know they don't like being critical of government in any way, shape or form, but
no, I think you're right. I think we definitely need to have clarity around risk. I think that's key, and I heard what you said, Mark, about the capital, but I think for me, because the spend is so great compared to what we spent before. So if we're going from about 500 million to, you know, 2 billion in 5 years, for me, always makes me a bit, oh, that's a lot. So I'm just wondering if we could make a recommendation that we get more information about the risk. And I think the risk on the revenue, because it's the risk to our revenue that is my greatest, or is one of the concerns that I have, because if we're trying to make all these savings and then we've got a huge debt that we need to pay off, which is coming from our revenue account, I would like some further clarity on that for next year's budget scrutiny. So if they can, well, actually, if they've got some for this year, that would be great. That'd be a recommendation. But if not, then actually for the following year's budget, so whoever's doing this next year will go, oh, risk on the revenue. And I think that needs to be put alongside the savings we're trying to make. So we've as Mark, as you said, it's really clear what we're trying to do and what's going on. Okay, other recommendations that I thought about whilst we were going through. Is there anything on the, Adrian, you were saying about the savings tracker? and you were saying about, was it aids and adaptations that you wanted to bring up?
More about the savings tracker. Yeah, it's probably the wire was loose. No, it's still giving it some, but don't worry about it. Yeah, I'm concerned that we're front ending those savings on the fast track financial assessments, and I would want that spread over a longer period. I don't think enough analysis has gone in to the impact and the risk of what's been proposed. So I recommend that is, if they're keen to make that sort of saving, then I would suggest that they back end it a little bit, and maybe, I don't know, have a small amount of saving in the first year so they can see what the impact has been of implementing the change.
That's a good idea, actually, because I think when this first came out, I'm sure the panel, and I'm racking my brains here, but I'm sure the panel asked to see what the impact was on residents. Maybe I'm wrong, actually, but it does sound. So I think the impact on the clients that we're, because I think for me the concern is about information at this point, because if you suddenly need care and you've got the financial assessments, like what information is the council providing so they can make an informed choice about what type of care they want? Because if they're paying for it or we're charging them for it, then we have to be really clear about how good our information is. So I think a recommendation on that, just to see what information they're providing to residents. You said spreading it over a longer period of time, didn't you, Gideon?
Yeah.
Okay, and yeah, and then just seeing if and getting if they've got some sort of analysis of how that's impacted on them, on residents, just to make sure that we're not charging people to a point where they're running into difficulties, and just making sure that joins up.
It'd be hard enough anyway with all the utilities going up.
You're right. I think for me, it's the aids and adaptations and hang on, we're staying on savings. I'll go back. Aids and adaptations is always my thing. But okay, on the savings track, is there anything else we want to put in on that? No, I think for me, I hear what they're saying about because this is the big. This is the big money that we're making in the savings. There's 4.1 million next year. I think for me, it's just an understanding of how well that's going. I know Sean said 80% was delivered last year. I'm just a little bit more concerned as we get to the end of these, these proposals, that it will be more difficult to make these savings. And I think, could we ask for a recommendation that we get a bit more analysis from that Jenny was talking about? To understand, have that confidence that these are, that the risks have been looked at in these different areas across the piece, and that we actually understand how difficult it's going to be at the end to get that last bit of savings through. But that's all I had on the savings tracker. Is there anything on the capital? I think I've given away what I want to talk about. So the capital, yeah. It's the capital projects programs. So this is the money that's being spent on the capital programs.
You've been on the panel longer than I have by a considerable margin. Osborne Grove. Did you know it was going to cost according to this, 44 million for Osborne Grove?
I didn't know what the total amount was. I know it's varied, but I know it's changed quite considerably from what it started out to what the end result is, because I know it went through that real co-design process, didn't it?
Okay, so I don't think I want to go as far as making a recommendation, but I wouldn't mind just it being noted that the cabinet member is keeping a watching brief on the money that's being spent on Osborne Grove. 44 million. I don't recall that figure. To be honest, that's a substantial amount of investment. And I'd want to see whether there's any match funding from Whittington Health before Siobhan Harrington leaves and goes to Dorset. Yeah.
No, that's, I mean, that's good. I don't know. I know that that's supposed to be self-financing, and I think that's because it's the 70-bed nursing home, so that obviously they can charge the costs. Yeah. So, but I think what would be really useful to know is at what point do we think that debt will be paid back? Is that is that self-financing? Because we have to borrow it, is my understanding, isn't it? And then we recoup the money as it comes in. So over what period of time? You put it on the thing.
No, just say it'd just be good to get a recap on the contributions from health and just an overview in terms of the finances and maybe what costs have increased over the last year or so.
Somewhere that there's going to be 10 residential flats.
I don't know. I mean, it might be in there. Have a look. So the other one was aids and adaptations. I think for me, this is the bit that I have a real area of concern, and I don't know why. Sorry, it's at 201 on page 69 on aids and adaptations. This is the bit that I have concerns about, because I get casework on this from people who've really struggled to get this set up in their home, and now they're really struggling at home. They've got young children with disabilities, they're just not getting that support. So I just don't quite know why this isn't working. So if we're putting in the money into making sure this works, I'm really concerned about, is the finances enough, or is there another problem in the system? Are we underfunding this area? And this is external funding, as John was saying. So are we not getting enough money in order to make this service work? So I would like a recommendation from the panel to really unpick a little bit more to do with the finances and the service and see where this problem is.
Perhaps you could educate me, where would we get this money from?
John say? John said the money was from
MRP.
Wasn't it the Better Care Fund?
Yes, Helena, you're completely right. My brain had gone. It was from the Better Care Fund. So we could ask for more money from the Better Care Fund. Just, if this is, if we're missing by, I don't know, a small amount, but it's making quite a substantial difference to people's lives, that's something. So I think we need to understand the case numbers that have been asking for this and how many we've actually managed to do the works on, and whether that's a staffing issue, we need to employ more staff, or there are no staffing, or is there some other problem in the system? Because this has been inherent, and I've been doing this with other councillors colleagues for many years, and we still quite haven't got to the bottom of what's going on here. So I think this was brought up with me when I pretty much about 2 years after I started, and we're still sort of seeming to have problems on the system. So that to me is an area that I'd like to make a recommendation on, just to get more information about that and find out what's.
Can I just ask
Helena.
a question, Pippa? That's I'm surprised that there's no increase in the budget over the 5 years, especially given that inflation's going up and these things will probably cost more. So I'd really like to understand why there's no inbuilt. Are we spending less year on year?
So you're completely right, and that was the recommendation that I made actually in the meeting, because No, you're right. It was a long time ago now. I'm just looking for the table. It came to light, didn't it, that though we'd had extra money coming into the the base budget, we were told that from the Strategic Reserve Fund, we actually were dropping, it looked like we're dropping our budget next year from 83 to 82. So I asked for further information on that as a recommendation as to why it, that's, sorry, Mark, you.
Didn't mean to cut. No, I was just thinking, sorry, because I'm sort of new to this, but aids and adaptations should be saving us money. Yeah. So maybe the way we frame that question, if officers agree with that, why are we then reducing? So that seems counterintuitive. If you want people to stay at home longer, if aids and adaptation is going to be one way to facilitate that and facilitate less likelihoods of accidents at home, people have to go up downstairs all the time, right, falling, getting into acute care. To me, these are the kind of things that, for me, seem to be the obvious things that you would want to be investing in and becoming more efficient with.
I agree. That's why I was wondering if we were under resourcing that from the Better Care Fund. So that's why I'm yeah, exactly so. And if we're doing that, why is that happening? So yeah, I agree. And then Helena's one about the base budget. Yes, Helena, that recommendation I made earlier on in the meeting tonight about understanding why this base budget is dropping if we are putting new money in, which we were told we were as part of the growth fund that we were putting into adults and health. I think that was it from me that I picked up as part of the meeting tonight. Was there anything else? So there's one about the base budget, one about the capital, the sort of the amount of money on the interest that we're having to pay back, and an understanding on the revenue, how that's going to impact on our revenue account. There's the recommendation about the formatting of the paper and the meetings. There's a recommendation on the Osborne Grove, aids and adaptations. What was the others? There was one other, I can't remember, but we said them earlier, so that's good. Hasn't got my notes, you can't see. I think that was it. Yeah.
Yeah, it was just linked to this whole point around the budget shortfalls in government funding, just trying to get more of a handle. Well, if government is shortfalling us, what do we need? What level of resourcing, with all our cost savings and efficiencies, everything else we've got planned, do we need from government to run, to kind of, to feel we could actually run the service effectively on that would be good to know. Yeah.
I think that probably concludes everything that we had to discuss tonight. I think what's going to happen now is Dominic will put forward these, and then we'll sort of tighten them up, send them around, make sure that we've captured them correctly so that everyone feels that they've, is what they've actually asked for. Oh, that was it. It was your one on assisted. Sorry, Gideon, it was your last one on AS101 and the fast track and the client contributions. That was your recommendation. That was the final one that I meant to do in the summing up. So that was the final one on page 72. And just trying to make sure.
Spreading over a longer period and probably back-ending it a little bit. So let's say 100,000 saving, rather than having 75 at the beginning and then spreading that the other 25 over 3 years, having maybe 25 at the beginning and then spreading it over, increasing it as year on year, so they can see what the impact is of making a small saving. Does that make sense?
Yeah. I mean, what you can do on this is also because the ones that are on the savings tracker, they will have been looked at in detail by the panel in previous years. So we'll go back, have a look at the minutes. There would have been a little pro forma, mini report on each one. So we'll put together the recommendations, as Councillor Connor said, and send them round. But I can also see if we can get a little bit of extra information on that. And then we can always refine any of the recommendations ahead of going to the OSC in January.
Yeah, because there was, sorry, and there was the final one that I made about the whole saving tracker is just about the risk. And I think understanding the risk as we get to the end of the savings, what is the risk that we're actually going to make those savings? Because, you know, the cohort, is it going to be more difficult to make the savings in that last tranche? And getting that information from Jenny, I think that she mentioned about what those risks are, and just that we can understand that as a panel. And that, I think, is that. So, okay, so do we need to do the work programme? Okay, just to note, there's the work programme on the end. So unfortunately, we couldn't make that. We were so close to be able to go. We cancelled Lower at Lowry House. And then we were like 2 days away from being able to go back. So it's really frustrating. We haven't been able to. Dominic, is there any update on being able to get any access or, you know, meeting or Teams call or anything with Zoom or with them?
No, I mean, I can try, but I mean, we had very clear advice that we can't visit. And obviously with things deteriorating at the moment, it's not likely to be possible anytime soon. But we have until March to complete the review. So if things are better in February, perhaps we could do a visit. If not, we might look at other alternative methods, whether it could be surveys or phone calls or Teams. I'm not sure.
It's so frustrating because Lowry House was the first one, so we should have got that one, but never mind. It is what it is. So thank you everyone for coming in, and thank you for going through all the budget papers and spending all your time on it. Thank you very much, and I'll see you. Yeah, what are we doing on Tuesday? Oh yes, we'll cancel. Yes, forgotten that. Okay, thanks very much. Bye, Helena. Bye, Ali. Thank you so
Bye-bye.
much.
Bye.
Thank you very much.
Thank you.
Have a nice evening.
Bye.
Happy
Thank
Christmas.
you.
My magnetic personality.